Hi, and thanks for joining us for our podcast. I'm Holly Gaddy, and today we'll be speaking with Kimberly Benson, lead therapist for Inner Health. Inner Health is a premier behavioral health provider specializing in mental health and substance abuse treatment services. So thanks for taking some time with us today.
Thank you for having me.
Today we're going to be discussing the impacts that mental health conditions can have on families, particularly when they affect adult children. So with that being the case, what are some common challenges you would say adult children may face when confronting mental illness?
Well, that's actually a really good question. Let's first talk about that. There's an acronym called ACA. It stands for Adult Children of Addicts. It actually goes a little bit further. It's Adult Children of Addicts, what used to be Adult Children of Alcoholics, and Dysfunctional Families. So it's still called an ACA. The acronym is. Now, what does that mean? Addicts, alcoholics, drugs, or dysfunctional families. That's critical to understand what that is. So as we talk today, I'm going to refer to the adult children as an ACA. As an ACA, I too am an ACA. I lost my father in his addiction in 2014. And so a lot of the problems are very, very similar. There's a lot of challenges. The first thing is that they have a difficult time with role reversal. Oftentimes the kids end up having to parent, or if they have multiple siblings, they actually have to change. Now they're the more responsible person. So it's parenting their parent. Oftentimes they're not able to just enjoy childhood and do the regular childhood things because now they have increased responsibilities of making sure the younger siblings go to bed on time, to eat, to clean, to bathe the younger siblings, or they fully engulf in their studies. You'll also see the challenges, whereas the kids will end up with perfectionist tendencies. They don't want to rock the boat. So if we're going to say it's dad, and it's not just dads, it's moms as well. So I don't want to, when I make the example, it's just an example. Like if dad comes home and he's angry or in a rage, maybe it's because he's had a rough day, stress, it's just that time of day, his team didn't win, whatever that looks like. Oftentimes kids will do what they can to be perfectionists to make sure not to make him angry so that there's not any more lashing out, yelling, screaming, unnecessarily harsh punishments, whatever that might look like. So the challenge is a lot of times one can be the kids are confused as to which version of their parents is coming home that day. Role reversals where the kids are having to now be parenting their parents, and then communication barriers. Now you notice that I'm also interchanging, and it's important to note here, an ACA is an adult child of an addict. So some I'll be going back and forth. When I talk about ACAs in their younger years, it's when they were young children before 18. An adult child of an addict is actually considered 18 and older. So when they're young, there are communication gaps. The kids don't know what to talk about. It's like walking on eggshells or thin ice. They don't know what they're allowed to communicate. Are they allowed to talk about what scares them or fears? The other challenges oftentimes come in is that an ACA, when they're young, actually start to develop what's called pseudo-alcoholism. And you're like, okay, what does that mean? Before they even start drinking, and some of them don't. They start doing tendencies like lying, reputation management, minimizing what the parent is doing. Oh, they're just sick, or they're just not feeling themselves, where they know what's going on, but they don't want anyone else to know. Most families have that old saying, what happens in the house stays in the house, so someone doesn't go outside and tell the business. So the communication barriers are very intense for a young person. When you're raised, the goal is to talk to a therapist, talk to a teacher, talk to someone, your pastor or another adult if you're worried about something in the home. When there's this kind of an issue happening, when you're talking about addiction or mental health or severe dysfunction in a home, then the kid is really confused as to who is my safe person? Who can I talk to? Who's going to protect me? Who's going to fix this? Will I get in trouble for communicating? That's a big deal. The other thing is if a child has two parents in the home, oftentimes the mate, the partner of the addicted individual starts doing the same thing, the reputation management or mitigating the damage control as soon as possible. So the kid doesn't know what they're allowed to do. Can I manipulate this one over this one? Can I get away with this? Am I not allowed to do this? And there's such a confusion as to what I'm allowed to say, what I'm allowed to do, what's appropriate play, things of that nature.
If you'd like to learn more about how to deal with things like substance abuse and mental health conditions in a parent or other loved one, you can reach out to the experts in inner health by calling 1-800-388-4601 or visiting innerhealth.com today. Kimberly will be hosting a webinar on February 13th, 2024 at noon, so be sure to check that out.